Hello, my name is Brad Lund, Executive Director of HBMA. Today I am joined by Adam Laing, President of HC Pro. In conjunction with HBMA, HC Pro designed an independent accreditation program for RCM companies. I'm going to turn the program over to Adam to discuss the accreditation program, but first I just want to state this program is among the most significant resources HBMA offers its members. Being accredited demonstrates not only to current clients, but potential clients, as well as our commercial and governmental payers, that you are competent in the compliance area. This is really important to your company, so I'm hoping that you'll spend some time listening to Adam go through the program, and we'll have some discussion if it warrants it at the end. So with that, Adam, welcome.
Thanks, Brad. I'm excited for the opportunity to be able to talk about the accreditation program with HBMA and HCP, and appreciate you inviting me and joining you on this live stream. To give you just a little bit of context, first thing that anybody that's listening or joining us would want to know about such a program like this is, what is the benefit? How can it help our business? How can it help meet our goals and objectives? And so I think that's probably the appropriate and the best place to start. The benefit really is, at a high level, is how we can help create a culture of compliance with each of the organizations, each of the members with HBMA. And that's kind of a high level, lofty goal and perspective when you think about creating a culture. But what we're finding in this day and age, and I'll just tell you, over the last couple of years, 10 to 15% of the clients or prospective clients that come to HCP are going through an audit or have just recently gone through an audit of some sort. And so we're really seeing an uptick, and that could be an uptick in, whether it's payer audits or a regulatory audit, CMS audit. We're just seeing that change quite substantially. And so when we talk about creating a culture of compliance, it really is positioning yourself well with healthcare, with protected health information, with making sure that you're paying attention to regulations when it comes to fraud, waste, and abuse, and all of the above. Our program is aimed at helping you to create that culture, and it's really twofold. Number one, we have an advisory team that each organization works with and is assigned to, so that any questions that come into the organization from a compliance standpoint, you've got somebody live, a team member that you're working with. And our team really is just an extension of that organization. And then the second part is we provide a platform. So from a technology standpoint, we provide assessments, the ability to track policies and procedures. I call it the repository, if you will, a place where all of your due diligence can go and to be tracked and managed, so that if and when whether you're going through an audit or have a concern or an issue, you can easily go back and find, hey, here was our policy. Here's what we've got acknowledgments on with all of our customers. Things like a HIPAA breach. You might have a HIPAA breach, and if so, you're reporting that to HHS. We help walk you through that, what the process is. If it's more than 500, we take steps this way. If it's less than, we take these steps. But all of that becomes due diligence. A lot of organizations that we've met with, and just recently we've had a couple of organizations come to us because of a HIPAA breach and the concern, and what do we do about it? And one of the things that I always like to say is not to be afraid of them, but understand that, and we've gone through audits with the OCR and with the OIG where when organizations have had a HIPAA breach and they've reported it, it shows that they're doing their due diligence rather than kind of ignoring it, but to be able to track it, manage it. Does it impact our policies and procedures? That can be a lot to think about with the compliance program at your organization. And the accreditation, really, to simplify things down, helps put steps in place for an organization to be able to create that culture, and then advisors that will help them to manage it. So any questions that come along, like a HIPAA breach or anything else. And then the last thing I'll just mention on that, and if you have any questions, Brad, is we make sure that the organization has a clear understanding of the requirements and of the regulations. And so at the end of the accreditation process, you receive that seal that you can put on your website that is an HBMA, HCP accreditation that says we've met these standards. We've put in the time and effort to be able to put our organization atop of any other organization out there and say that we've done our due diligence. And when from a marketing standpoint or talking with providers and healthcare organizations, you can really show that not only are you going to be able to take care of your customers, but you're also going to be able to limit and reduce risk and liability as an operating process and service for your customers. So that's kind of it at a high level. If you have any questions, Brad, I'd be happy to entertain them.
I do have a few. So I heard you say at the beginning, you have a number of RCM companies coming to you that are either about to go through an audit, going through an audit, or has gone through an audit. If they're not accredited by you, can they still come to you?
Absolutely. And really, that's typically where we start that conversation about accreditation. And let me be clear, we have RCM companies, billing companies, we have all types of healthcare organizations. And so when I talk about 10 to 15%, that's really kind of across the board of any number of organizations that come to us. But great question. So anybody that is going through an audit or having a concern, questions that come to us, we talk to them about the accreditation program, how it can be beneficial for them, and really start working with them right away. So if it's an audit that they're going through, we want to be proactive in that. One of the things that I often talk about, in fact, at the last conference, I brought Chad Schiffman with me, who was also in our speaking engagement. But Chad's our risk and compliance manager or director at our company. And I always talk about the value that he can bring to the table, because we've had customers that have come to us that have had and run into issues, have been going through an audit. A lot of time we have companies that come to us that have already paid the fines and fees to the OCR. But what people don't understand oftentimes is it's not just the fine or the fee that is the expense. The corrective actions. We had a company come to us 2 years ago after they'd already settled with their fines and fees. And it's been about a 2-year process to get them on the other side of the corrective actions with the OCR. But what this has done for us is it's given us great experience to be able to work with any customer, any member, any organization that comes to us and have that experience of working with the OCR, working with the OIG, and how to work through this. And so one of the things that we talk about with the accreditation program is that, and I mentioned it earlier, that our advisors are an extension to your company and to your organization. So when if you run into an issue that you're being audited, Chad or one of our team members run point on that. So we're the ones that are responding. We've responded to a number of these type of audits. And so that concern and the stress that you can go through as an organization and the time that you can spend on responding can be great. But that's really where we come in and we take over from that process to help lead you through any type of an audit or a concern that you might run into.
I had a conversation yesterday with a healthcare consultant that works quite a bit in the RCM business. And he was quite critical of us, of the RCM industry, talking about how we're reactive rather than proactive. When he was talking to me about that, I was thinking about you, because every time I talk to you, there's something new that comes up that gets me all excited. But you got me very excited one day because you talked about specifically coding audits. And you have a system in place where you can run all that data through your system, and you can communicate back to the accredited RCM company that you've got some risks here because of how you're coding. Could you explain that a little bit?
Absolutely. And I kind of alluded to, this uptick with what we're seeing in the industry with audits that are coming through. And in talking with RCM owners and administrators and billing companies, it's been interesting. Really, where we can come in is we can pull the data from your providers, as well as data that you're coding on behalf of the providers that you're working for, and we can look at the data as if we are a payer or as if we are CMS. All of that data that, when we work through the EHR system and we get the benefits, whether, from CMS, what they're doing is they're collecting that CERT data, and they're looking and using that data to be able to help them determine where there's areas of concern and if there is a particular group or practice that we need to audit. So we take the same data and we run it through data analytics to be able to really look at the practice, the provider, the coding, and see where the risk is. Are there particular providers in a group that are high risk and maybe the other ones are okay? Once we can identify that, then we can put an audit action plan in place, which includes training to really help make sure that we're in a place of managing that risk. When you think about, or I'll just tell you from our perspective, some of the biggest issues when it comes to financial concerns come from recoupment. So if you have over coded, and then the payer or CMS is coming back for a recoupment, those exceed almost any fine or fee that we've seen from a regulatory body. And so it is a big concern. And what we can do is help, as you had mentioned, proactively look at the data. And if there's a need for a change, we can start educating the providers and your internal coders that changes need to be made. And then, if there still is an issue or a concern, we can look at back. Again, I kind of refer back to that repository, but looking at corrective actions, re-educating, realigning. And I've said this many times and I'll say it again, the regulatory bodies, payers that we've worked with, when they see corrective actions, it shows due diligence. And it makes a big difference, from a proactive standpoint, to be able to answer, to be able to respond with, if it is a corrective action that we're being audited for at the time, or if it's something in the past. So definitely from that standpoint, we want to put your organization in a place where you're being proactive instead of having to go through it, reactively.
So just so I understand it, a good compliance plan will have elements in it that speak to internal coding audits and external coding audits. Does this replace any of that? Does it augment it? How does those internal and external audits that the billing company should be doing interface with what you're talking about here?
Well, that's such a great question, Brad. And really, it's twofold. Number one, certainly from an internal perspective, the whole concept of having a compliance program. In fact, if you think about the 7 elements of an effective compliance program that the OIG put out years ago and have reassessed it, in regards to corporate compliance just recently this year, and the DOJ has also hit on it. But the 5th element is really to provide internal monitoring and auditing, always assessing to make sure that we know where our vulnerabilities are, where concerns are. And so to kind of speak to your question, we help put that in place. So our entire services and offerings are built around those 7 fundamental elements. And in 2-part. One, our advisors work with our groups in regards to those elements, and then our software is the same. So when you think about, the number 1 element is policies and procedures. What we've found through going through numerous audits over the years is the first question that you're going to be asked is, do you have policies and procedures in place? That's always the first question. The second question is, part of that is, and are they updated? And the second, follow-on question to that is, can you show us that your staff and employees are aware and are familiar with what those policies and procedures are? And so we look at that and to help answer, getting back to your question, as far as having an auditing system in place, we look at that process all the way through each of these elements. So when it comes to policies and procedures, we want to be proactive. I'll share an experience with you. We just had a prospect reach out to us that had sent an MRI via email to the wrong patient. And so they, realized that had happened, didn't know exactly how to report it and go through it. What we do in a case like that is we look at what the policy was. Was there a policy in place that really should have kept us from, or an individual or the system sending that to the wrong person? And if that's the case, we did have the policy in. It looks like somebody just wasn't educated on it, didn't understand it. Then we don't need to update the policy. Then we just simply go in and we look at corrective actions. But we want to document that and track that we've done that, so that if we do run into an issue with that or larger than that, we can always go back and say, here's the policy and procedure. Here's what we did in this case. Maybe in some cases we have to update it. And I'll tell you, with technology changing all the time, new ways of receiving information and sending information, policies and procedures really should be dynamic. And to be able to track that through the whole process of auditing ourselves and where are we at, and the policies should reflect it. And so when you think through that, our system really is built in to create that culture, to think about what areas do we need to consistently look at and audit. So not only from a coding perspective, but really all the way through, when it comes to fraud, waste, and abuse, when it comes to tracking and managing protected health information. These things can seem daunting. I'll just tell you that. One of the first things when we ask somebody, when we're doing a consultation, that have either found us at a conference or on our website is, what was your main interest in today? And almost 80% of the time it's, well, I'm concerned because I just don't know what I don't know. And that seems to be the case with most people that we talk to. And I had a great experience early on when I had just started with HCP at a conference, where I had a gal kind of walk past our booth and said, kind of just as in passing, "Hey, I'm a customer. You guys are great. Love working with you," and kind of continued walking on. And of course, as a CEO, I want to learn more. I want to hear more about that. And so I kind of chased after a little bit and said, "Hey, I'd love to hear more. I really appreciate the great feedback as far as appreciating our company. What makes you say that? How do you feel about our services that you would respond like that?" And I'll never forget, because I think this is really, similar to what most of our customers are feeling and thinking. But she had a kind of a unique perspective, in the sense that she was a corporate attorney and had worked in the corporate world as an attorney for many years. And then her husband, who was a provider, expanded their practice, and she decided to become the practice administrator, working with his practice. And she said, from an attorney's perspective, thinking about all the regs, all the statutes, all the laws, requirements, I couldn't sleep at night. And so I'm just thinking of all the things that I didn't know and needed to do research on. And she came up to me and she said, "I can sleep at night because of your company." Now, that's not us taking the responsibility off of somebody's hands as far as compliance, but what she understood is that our program really helped her to create that culture, to help be aware of the things that she didn't know about, and allowed us to kind of be a great partner for her in that. And that's I think the biggest value that we can help bring back, and is really the intent as far as the accreditation program.
Good story. Good story. We're about out of time, but I have to go over one other thing you told me about a couple of months ago that just made me very excited. Probably 6 months ago, I was sitting with some leaders of HBMA, and I said, "What are we going to do with compliance?" To me, HBMA is responsible for creating and delivering compliance resources to our members. And one of the leaders looked at me and said, "The problem with compliance is it's boring and it's expensive." So I said that to you in one of our meetings, and you said, "Well, no, not really." And I know we're not ready to roll out the data to support this, but what you said to me was that it doesn't have to be expensive. It can be a profit center. So again, it might be a bit of an unfair question because we're not ready to really detail the information, but from a high level perspective, can you tell us why do you say that compliance can be a revenue center?
Yeah, there's really a couple of elements to that, and you just made me think. I just read, and I'm gonna borrow from it, something I just read from the HHS that had released today about. Let's see if I can find it. I'll share this with you. This is actually from the OCR. They talked about a company that had just been fined, I think, almost $500,000 because of a data breach. And again, that isn't the biggest concern. The bigger concern is going through all of the process afterwards, right? The corrective actions, working with the regulatory bodies, et cetera. But it was interesting. Couple of things that really caught my attention was they mentioned 89 million individuals have been affected by large breaches. And you think about that, that's 25% of the population of the United States. And so that was just daunting to me to how rife I think our systems are that aren't doing proper security risk analysis and et cetera. But this is what they mentioned in here that I think helps with answering your question. They talked about phishing attacks, which is the number one reason that a breach is happening today. But they said, this can result in financial loss, discrimination, stigma, mental anguish, negative consequences to the reputation of that organization, health or physical safety of the individuals, that are involved in that. They talk about all of the intangibles outside of the fines and fees, and then all of the corrective actions that are so impactful. So when I think about, and that's just one small facet of it, being proactive and putting yourself in a situation makes all the difference in the world. Because I'm going to tell you, there's going to be HIPAA breaches, and there have been a lot of HIPAA breaches where data has been, for one reason or another, whether it's theft of an actual physical laptop or information that has been hacked into. We're never going to stop that from happening. But I can tell you, I shouldn't say hundreds, but so many times where we've had to deal with a breach. But when we've shown that our due diligence is in place, the audit has gone by fast, the response has gone by fast, and it changes everything from the impact to that organization. That's one small slice when you look at that. The same thing I would say when it comes to coding. So, when you're looking at medical decision making, you're looking at proper documentation. Those things can be costly. Like I mentioned before, those can be way more costly than getting a fine or a fee when it comes to the dollars that are impacted. So the return on investment, if we look at it from that perspective, if we can help your organization focus on what they do best, helping your customers to achieve their goals and objectives of revenue and being efficient and creating that efficiency all the way back to the provider, that's part of the return on investment you're getting. When I hear people say, I can sleep at night because my organization has a culture that is helping us to avoid these concerns and issues, that tells me that frees up a lot of allocation of resources to be able to focus on what you do best and allow us to be able to come in and help from the other perspective to really put you in a place where it can be a profitable venture. And not only the negative impacts, but there's times even from a coding perspective where you're missing opportunities of revenue, and that we can help find and assess those things as well and bring in more revenue. So a number of those things really from a proactive standpoint can help, Brad, with bringing in a return on investment.
Thanks. That was a pretty good answer. And I know we're not ready to articulate that through data, but I was so delighted when you said that to me, that it doesn't have to be a cost center. It can be a revenue center. So we are out of time. Adam, I am so grateful that you spent a half hour with us talking about the program. It's a program that we are absolutely committed to. It's of great benefit to our members, and we look forward to continuing to grow it. And for all of you HBMA members out there listening, we are in due season. This is one of the great benefits that you have access to when you belong to HBMA. Thank you for your time. Have a good day. Goodbye.